What is Ascariasis? Ascariasis is a parasitic infection of the small intestine caused by the roundworm Ascaris lumbricoides. It is one of the most common worm infections worldwide, especially prevalent in tropical and subtropical regions with poor sanitation. The infection occurs when a person ingests food or water contaminated, when roundworm eggs which hatch in the intestine. The large larvae migrate to the body, including the lungs, before maturing into adult worm in the intestine. Cause and risk factors of Ascariasis. Cause: the infection is caused by ingestion of Ascaris lumbricoides eggs found in the contaminated food, water, or soil. The eggs hatch in the intestine and the larvae travel through the bloodstream to the lungs before returning to the intestine, where they mature into adult worms. Risk factors including living or traveling to the areas with poor sanitation and hygiene, especially in tropical and subtropical developing regions. Children at higher risk due to playing in contaminated soil and putting hands on objects in their mouth. Using humans' feces as fertilizer, night soil. Increased risk by contaminating crops and soil. Crowded living condition and lack of access to clean water. Poor hand washing habits is not washing foods and vegetables thoroughly. Focusing on these cause and risk factors is important in both prevention and patient education for Ascariasis. Signs and symptoms of Ascariasis: low-grade fever, cough and bloody sputum, wheezing, abdominal cramping and discomfort, nausea, vomiting, worm anorexia, diarrhea as passing worm in stool, small bowel obstruction, mainly in the children, pancreatitis, worm migration, appendicitis, worm migration. Ingestion of ineffective Ascaris eggs from contaminated water, food, or soil, especially vegetable fertilized with human feces. Eggs hatch in the intestine releasing larvae, then direct to larvae penetrate the intestine wall and enter the bloodstream and proceed to larvae migrate to the liver, lungs, and proceed larvae pass through pulmonary capillaries and alveoli. Direct to larvae move to the bronchi, trachea, and epiglottitis. Larvae are cough are and swallow. Larvae return to the intestine where they mature and mate. Matured worm cause local inflammation and immune response in intestine, liver, lungs, and biliary tract. Clinical manifestation such as abdominal pain, nausea, vomiting, loss of appetite, and respiratory symptoms occur. Ang bulate o Ascariasis ay nakukuha kapag nakakain tayo ng itlog nito mula sa dumi na nasa lupa, tubig o gulay na hindi nahugasan ng maayos. So sa loob ng tiyan, doon sila nangingitlog at tumalabas ang bulate na pumapasok ito sa dugo at dumadaan ang mga bulate sa atay at baga tapos umakyat sila sa lalamunan. Tapos naiubo or nalulunog sila pabalik sa tiyan para doon sila mamuhay. Kapag doon sila namuhay ay nagdudulot sila ng pananakit ng tiyan, pagsusuka, pagkawalan ng gana sa pagkain at hirap sa paghinga. Kaya mahalaga ang maglinis ng pagkain at maayos na kalikasan para hindi tayo mahawa sa ganitong kondisyon. So, nursing diagnosis of Ascariasis include self-care deficiency, altered nutrition less than body requirement, alteration in bowel elimination, and fear, pain and discomfort, and high risk for infection. Nursing intervention of Ascariasis is isolation is not needed. Preventive measures in each home and in the community should be enforced. All members of the family must be taught on sanitary practice such as hand washing of hands before handing food, washing of all fruits and vegetables that are eaten raw, and effective sewage disposal. Availability of toilet facilities must be ensured. Importance of personal hygiene should be explained. Proper disposal of diaper should be emphasized to mothers. Medical management treat with albendazole or mebendazole or invermectin at antiparasitic medicine. So surgery may be needed for bowel blockage or complication. Supportive care, hydration, and nutrition if needed. Prevent reinfection with better hygiene and sanitation. So, diagnostic tests of Ascariasis include this tool for OVA demonstration of fertilized or unfertilized eggs in the stools, or that's we call cat-to-cat techniques. So, abdominal X-ray test shadow adults Ascaris which look like strand of spaghetti, and routine blood count or significant of eosinophilia. So, complication of Ascariasis include number one is biliary tract obstruction, patient develop cholestatic jaundice. Number two is hepatic abscess and cholangitis. Number three is intestinal obstruction, perforation, peritonitis. Number four is malnutrition due to damage of the intestinal mucosa, which impairs the absorption of nutrients. Prevention of Ascariasis. Number one, improve sanitation and hygiene practice. Number two, improve nutrition. Number three is deworming may be evidence. Number four, when traveling to areas where sanitation and hygiene are poor, avoid water or food that may be contaminated.